Insertion and removal of a catheter. I would first insert by performing hand hygiene, introducing myself, verifying the client's name, date of birth, and allergies. I would then verify the order for the type of tube for the catheter. I would then provide privacy by closing the curtain and closing the door. I would then explain my procedure to my client. I would then gather my supplies, raise the bed to working height, donning my gloves, and if I were doing this on a female, I would place her in dorsal recumbent position with her knees flexed. I would then assess the perineal area and then remove my gloves and perform hand hygiene. I would then open the kit and keeping the tabs away from me, not breaking sterility, and place them between the client's legs. I would then pick up the gloves pick up the sterile gloves and put them on. I would then remove the top tray and place it onto the sterile field. I would then remove the cleaning swabs from the tray. I would then open the lube and place it on the tray. I would then insert the balloon syringe and place it on the port of the balloon, but not inflating it yet. I would then open the catheter from the plastic sheath and I would place it into the lube. I would then cleanse the urethral meatus from the outside, inside. I would then pick up this catheter from the lube and place it in my dominant hand, coiling it so it would be easier to insert. I would then ask the client to bear down as if they were needing to urinate. I would then slowly and smoothly insert the catheter into the urethral meatus. I would then, once I seen the urine flowing into the bag, I would then slowly insert it another approximately 2 inches. I would then inflate the balloon, holding it with my non-dominant hand and tugging on it gently to see if it is in place. Then if it were in place, I would secure it to the client's leg with a securement device called the stat lock. I would then hang the drainage bag on the bed frame, and then I would clean the perineal area and dispose of my used equipment, remove my gloves, and perform hand hygiene. Then I would document my procedure. And that is it for the insertion. For the removal, I would again introduce myself, verify the client's name, date of birth, allergies. I would then verify the removal of the catheter. I would empty and drain the bag and I would measure it. I would then place a waterproof pad underneath the patient so nothing gets on the sheets of the bed. I would remove the catheter securement device on the that's on the thigh. I would then insert the syringe onto the balloon port and let it drain by gravity. I would then slowly pull the catheter out, letting the patient know that I was going to do it. I would then wrap the catheter up in the waterproof pad, and I would assess and clean the perineal area and remove my gloves, perform hand hygiene, and document my procedure.